still our children. We spend a lot of time with our patients at Sick Kids, and with the families, there's a long relationship that is coming to an end, not a total end, but we're separating and you're crossing the street. Going over to adult providers, these providers have to earn your trust, and you have to adjust to the way things are done in the new environment. And coming across the street, there's also establishing new family roles. The pediatric and adult centers are two different cultures, two different environments. Adult caregivers have identified a number of concerns about patients who've transferred from pediatric facilities, specifically lack of adherence to treatment plans and deficiencies in knowledge about the condition and limited self-care. These differences can be partially explained by the mandate of the pediatric and adult services. Pediatric care is family focused. It relies on developmentally appropriate care with a significant parental involvement in decision making and in administering care to the children. Adult care is patient focused, and it requires patients to become more autonomous, independent, and advocating for themselves, and in some ways it's a little less of a both centers have a multidisciplinary team, but the pediatric center, it's a much, we both have social workers and nurses and physicians, but in some ways they're more team members over the pediatric center, everybody providing family focused care. A few things to remember. Your adult caregivers are knowledgeable and want to work with you. Every institution has a slightly different way of doing things, and different doesn't mean incorrect or wrong. Ask for an explanation of why something is being done in a different way. Don't get angry. You have to ask. Ask questions. When everybody has a good communication in both directions, then there's no anger and there's no disappointment. Be open with staff about your life, what you're doing in school, what you're doing at work. If there's a day, for example, if there's a day that you prefer to come in and have your appointment, a specific day of the week for your transfusion, for example, on a chronic transfusion program, and as a result of this day you have just make it up, Fridays I always have my day off from work or from school, or lighter caseload at school, let your caregiver know, so that when you're booking appointments, you ask for a Friday and they can try to accommodate your wishes, and you work together to come to a happy arrangement. If you have an appointment that you realize it's an exam day for the young folks at school, as soon as you realize you get your schedule is an exam day, you call and say, I have an exam that day. Don't just not show up. That doesn't go over very well in any setting, but it doesn't go over well at all in an adult setting. The first year after transfer is not only about learning to trust new caregivers. You have to learn about what the new expectations are for the new environment, but there are changes happening that are most important for the future going on at this time. Ending high school and going to tertiary education is another huge adjustment. This is adjustment for anybody, with any young person leaving home, going off to school, maybe out of the city, or leaving home, going to a new apartment, new living arrangements. In a new environment with new friends and acquaintances, some patients, I'm just saying this from some personal experience. If you're leaving home to go to a new environment, figure out what you are going to share with your roommates, and this decision to share is really a very personal decision. But I'm giving you an example. If you are going to keep your blood disorder private, then if you have to do medications, that are visible, like giving Desrol or mixing pills, then you have to figure out what kind of living arrangements you're going to have, because we've had patients who have roommates. It's a big secret. They don't want to let it's their private decision not to share with their roommates the fact that they have thalassemia or sickle cell and are taking Desrol. And what happens? Compliance goes down, because you have an environment where you can't mix your Desrol until your roommates go to sleep. That happens at 1 o'clock or 2 o'clock, because they're all young people, they don't go to bed early, and then you don't end up doing your medication. So when you leave home, or when you go into a new living arrangement, figure out think further along about just not who your roommate is going to be, but more of how you're going to give self-care. Schedule your healthcare at healthcare appointments the same way you keep track of your dates with friends, school exams. You schedule your healthcare appointments in the same way, and keep track of it. Everybody has a phone or a BlackBerry nowadays. You put it in. If you want to, make a reminder when you have to take your medication. Life is very busy. Put an alarm in to remind you every day to take your medication. Schedule appointments. Keep in an organized way, in the same way you organize your academic work and your employment, and so that you can keep on track of all your appointments. Self-care, being compliant with medication, keeping up with all your appointments keeps you healthy, and that's the whole point of receiving good health care, is to have yourself in a very healthy state, and to be able to participate in life fully in all manners. So just a few words from personal experience that I wanted to share with you, and I'll close for the day, and I'm available for any questions or anything. It's a big difference, a pediatric setting and an adult setting, but it can work very well with communication, good communication between your caregivers. Okay, thank you.